8:13, Tommy Tucker, WWL. Got Chris Coleman running Master Control today. A little intro music for you there, Dr. B. How you doing?
I'm doing good. I like the bumper music.
Yeah, we're going to have to do that from now on. Chris Coleman on top of it. Anyway, Dr. B joins us now. Dr. Brent Wallis, Chief Medical Officer at People's Health. He gives us some good medical advice every other Thursday. If you haven't visited your primary care provider this year, don't forget to schedule an appointment. Dr. B is going to talk about that today, about discussing primary care and 5 tips for making the most of your next visit. And I guess, Doc, before we start, we got to talk about what is a primary care provider.
Yeah, sure. So I love this topic because I am a primary care provider. So a primary care provider, or sometimes we're called PCPs, is really just a doctor who practices general health care. We see a whole myriad of things, really focused on preventative care, giving you recommendations on vaccines and cancer screenings and other health screenings. We can make a lot of healthy living recommendations to you, things like diet and exercise in particular. But then we also treat a lot of acute illnesses, things like sinus infections, the flu, maybe minor injuries. And then really bread and butter is we help manage those long-term health conditions that people have, things like diabetes and heart disease, to try to get you on the right path to health.
Why is it important to have a primary care provider?
Well, it is very, very important, and the reason is through those visits that you have with your PCP, they really get to know you. They get to know about your health conditions and your medical history and your family history, and that really lets them monitor any changes that happen over time and maybe identify things that could be headed off. It's going to give you really more personalized care than if you're getting care from someone that you're seeing for the first time every time you talk with them. And then your PCP is going to act kind of like the captain of the ship. They're going to help you navigate this extremely complex healthcare system that we have. They can recommend preventative care activities. They can refer you to specialists if you need specialty care, and then they can communicate with your other doctors to make sure that if you're seeing a whole bunch of doctors, that everything works together and there's nothing that conflicts there.
Like an air traffic controller almost coordinating everything, huh?
Exactly, and can be pretty stressful like that, too.
How often should you visit your PCP?
Yeah, so this is what a lot of people don't do, but everyone needs to see a PCP at least once a year for a checkup. That's really important. And if you have a chronic medical condition, like I mentioned, diabetes, high blood pressure, high cholesterol, your PCP is probably going to recommend that you come in additional times. And that's, really important just to make sure you're taking care of yourself.
Yeah, well, why is that? Just to make sure that you do following the necessary protocols and so forth?
Yeah, exactly. When you have these long-lasting health conditions, you really do need a personalized plan of care. It's not the same for everybody. It's going to include all those medical services and probably some prescription drugs, a lot of education on healthy living recommendations. Those additional visits that you have with your PCP really helps us to create that plan of care and guide you through it. You can't do everything in just one visit a year. There's usually too much to go over. And so we're going to check how well your treatment plan is working for you, monitor for any new symptoms. We're probably going to order some lab testing and kind of confirm what's working and what's not, and then adjust your medications if we need to.
It seems like it really is important to have one person that's controlling not controlling, but coordinating all of the other doctors to make sure that one doctor is not giving you something that hurts you, given what the other doctor is giving you and all of that. Right, Doc?
Yeah, exactly. That communication piece is often lost when you're seeing multiple providers, and so it's really important to have somebody that's going to synthesize all that information together.
So let's talk about making the most of a primary care appointment. You got some tips for us. What's tip number 1?
Yeah, so this is really important. You want to prepare for your visit. When you've got an appointment scheduled and everything, number 1 is make sure that provider is in your insurance plan's network. You don't want to get a bill after you go to see the doctor. That's really important. And then if you need any special accommodations, or maybe you're bringing a parent and they need an accommodation like a wheelchair or maybe a translator, you want to make sure the clinic knows that before you get there so that everything's ready to go for your appointment.
And what about the day of your appointment?
Yeah, so when you show up, you want to make sure you bring that insurance card. They're always going to ask you for a photo ID so they can confirm who you are and everything. They're really going to want to see your list of medications, and it needs to have the dosages on there. And, I tell people actually bring all of your medicines with you if you can in a little bag, and make sure you include any over-the-counter items that you're taking, so vitamins or supplements, because we need to look at those and make sure that they don't interact with anything that you're on or anything that we may prescribe to you. So really, if you can, bring them in their original bottles so we can read the label.
And honesty is important, right? You don't want to exclude anything just because you think the doctor's not going to like it.
Exactly. Yeah, we want to know the truth so that we can create the most accurate health plan for
And that
you.
brings to why you need to bring a medication list. Why is that so important?
Yeah, really knowing that full medication routine is going to make it easier for us to figure out if you're having side effects, why you may be having them. Do we need to adjust doses? Do we need to stop medications or maybe change some medications? Some medications may work less effectively if they're taken with another type of medication. So we really need to review all of that to head off any potential problems.
Some other things you can do to prepare in advance?
Yeah, before your appointment, you really want to kind of prepare by thinking, what do I want to talk to my doctor about? What has changed in my life, especially if it's been a few months or maybe a year. What has changed since the last time I went to the doctor? Am I having new symptoms, or are there any new goals that I want to do? Like maybe I want to lose a little bit of weight or I want to eat more healthy. And it's good sometimes to just write that information down, bring it to the appointment, and that way you don't forget to talk to your doctor about something really important. And if you're seeing a brand new provider, it's also very important to bring notes about your own medical history and your family's history as well. That's going to be really key to understanding your overall health.
All right, let me take a break. We'll pick it up. We come back. You want a successful appointment with your primary care provider. And what's that old saying? Success happens when preparation meets opportunity. So you got the opportunity to see the primary care provider. It's up to you to prepare to make sure that you have a successful appointment. We'll pick it up with Dr. Brent Wallis, Chief Medical Officer of People's Health. And when we come back, 8:20 Traffic Now, WWL. All right, we're talking to Dr. Brent Wallis, Chief Medical Officer of People's Health, about primary care physicians or providers and how important it is to see them at least once a year and to have one. We're talking about the 5 tips to get the most out of your visit. First is preparation. What's the second one, Doc?
Yeah, if you can, you really want to try to get to your appointment a little bit early. Most clinics recommend 10 to 15 minutes. And the reason for that is to really maximize your time with the primary care physician to make sure that visit isn't rushed at all. You're going to have to probably fill out paperwork. That's inevitable. And so you want to kind of look to see if your clinic has the option to check in online or complete some of that paperwork in advance, because that'll give you more face-to-face time with your doctor to ask all those questions that you might have, and you don't spend all that time in the waiting room.
And we've briefly addressed number 3 already, but what is it?
Yeah, so honesty is really important. You're going to get the best care when your PCP knows, everything that's going on with your health. And so don't lie. That's not going to help you in the long run. If you smoke cigarettes, let us know about that. We can probably help to find solutions for you to quit. If you don't really exercise that much, let us know. Maybe we can give you some additional routines. So it's really it's very important to be honest, like you were saying. You
don't want to lie to your lawyer. You don't want to lie to your doctor. Those are 2 people you want to be absolutely honest with. And, Doc, when it comes to the lying, I remember going to ENT one time, and he said, well, you been digging around in there? No. Really? Because they got a lot of wax jammed in your ear, and it was is what I'm saying, right?
We usually do know when you're lying, and so we may ask some leading questions.
All right, what's your 4th tip?
Yeah, the other thing is don't be afraid to ask us questions. Some people kind of come in for an appointment, they listen, they don't say very much, and we're not entirely sure if everything is being absorbed. We cover a lot of information in these appointments, and they're usually relatively quick, and so you can get confused. We're not going to mind if you ask us to repeat things. You just have to make sure you ask us. We want you to understand.
And you got a final tip for us?
Yeah, the other thing is take notes. Like I said, there is a lot of information. There's a lot of, new medications that may have complex instructions, those healthy living recommendations. You can jot all of those down and then actually ask us, because quite often we will print out all of that information for you when you leave the clinic so that you've got it available for you for your next appointment.
So when it comes to the part with the preparation, I want to get back to that real quick for just a minute, because so many times I'll leave a doctor's appointment. It's like, oh, man, I wanted to ask him that, or I wanted to ask her this. That's why it's important to make a list of questions, and you doctors don't mind if patients come in with a list of questions. If anything, I guess it makes it more efficient for everybody, right?
Yeah, absolutely. I love it when patients come in. Sometimes they'll have a really long list, and so I will tell them, okay, we're going to try to address as many of these as we can, but that may be a reason that you need another appointment sooner than a year from now, because if you do have a lot of things going on. But no, I write down all those ideas, because when you get in the room, and we're examining you and asking you a bunch of questions, you may forget what is on your mind, and then you don't address everything, and you really need to.
Valuable information. Thank you, Doctor. I appreciate it. Have a great weekend.
Thanks, Tommy.
Pet those boxers for me, all right?
I know, absolutely.
Dr. Brent Wallis, Dr. B, Chief Medical Officer of People's Health. If you want to find out more about People's Health, you can visit the People's Health Medicare Center in Metairie, 3017 Vets. It's located between North Causeway and Trader Joe's. You can't miss it. Appointments are recommended, but walk-ins are welcome. They'll walk you through whatever's going on. You can visit the website at peopleshealth.com or call People's Health at 1-800-978-9765. peopleshealth.com or call 1-800-978-9765. When we come back, we'll talk with David Schanzer, a professor of public policy at Duke University and an expert on terrorism, on this 24th anniversary of 9/11, how the fight against terrorism has changed. We'll also talk about what's going on with Russia and also with Middle East with Qatar. Right now, time for WWL First News. For that, we'll go to Ian Ozan.